Hello, everyone. My name is Tyler Stone. I am the project director for the Native Connections Grant at the Muscogee Nation Department of Health Behavioral Health Services. And I'm really happy to be here today to share some mental health tips with you today. Um, the goal of these video series that we're doing is we're wanting to provide mental health tips that are really short and sweet and kind of to the point that help educate parents, guardians, friends, other family members, and just people in the community in general. So we hope that you find these videos helpful. They're really short and quick, easy to digest videos to learn a little bit more about mental health and how to help somebody out. And each video is going to have a different topic. And in today's topic, we are going to be talking about signs of suicide and how to help somebody who may be struggling with suicide, having thoughts of it. Now, before we begin, I do want to touch on a couple of things, right? Because I know that talking about suicide can be a very hard and scary topic. It's a very heavy topic and it's affected a lot of people. A lot of us probably know somebody who has struggled with thoughts of suicide, or we may be suicide loss survivors ourselves, meaning we lost somebody close to us to suicide. I myself am a suicide loss survivor. I've lost a couple of friends now to suicide. And in this field, it can be really tough to have conversations about it. But it's also very important. But I do want to say, and just kind of insert a bit of a caveat here, is if during this presentation, if it feels like it's too heavy and you need to kind of step away for a little bit, maybe come back to another time, please do so. Anytime I have these conversations, I want to make sure that everyone takes care of themselves during any training or any discussion we have about this topic. And I know that these conversations, if we do decide to bring them up with somebody who we're concerned about, can feel very uncomfortable, but it is necessary. And what we're really wanting to do is to learn and understand how to become more comfortable having those conversations about suicide with people who may be struggling. And with a little knowledge, we can help save a life. And what we're going to do is just go over a couple of tips on what to look for, how to help somebody out, and what that kind of looks like in real quick, easy to understand terms. I do want to start off with a couple of suicide myths that we hear about a lot. One of the biggest myths that I hear all the time in the field of suicide prevention is that if I bring up the word suicide, or if I ask somebody if they're suicidal and they're not suicidal, I will put that thought into their head. And maybe suicide wasn't on the table for that person, but because I brought it up, now they're thinking about it. And I really just want to dismantle that myth. We know that asking somebody directly about suicide not only lowers their anxiety, but also opens up that line of communication. So we know that you can't put the idea of suicide into somebody's head. In fact, asking somebody directly if they're suicidal, and if they are, it's two things. One, it shows that person that we care and that we notice that they're in pain, because a lot of people who are struggling really want people to know that they're in pain, but some people have a really hard time reaching out and saying, hey, I need help, or hey, I'm struggling. Another myth that we hear is that people who talk about suicide aren't serious. And that's actually not the case. The more signs and symptoms that we see in a person who may be suicidal, the greater the risk for suicide may be. So it's important that we're taking those signs seriously. And another thing that we hear is that suicide happens without warning, just kind of out of the blue. We know that most people will communicate in some way their suicidal intent about a month before their suicide attempt. Some of those are more clear and we understand those more. Some, it could be very obscure. Maybe we don't always see those warning signs. So when I go over this training today, these aren't going to be the end all be all. There's a lot of great resources that are out there, which I will talk about here at the end. But we're going to go over just a few, just something to kind of get your head wrapped around. What are some things I should be looking for in my friends and family who may be struggling with some of these thoughts? So tip number one is, let's talk about some of those warning signs. We always want to look for, are people talking about it? Are they talking about dying? Are they saying, I wish I were dead, or I just can't go on living anymore? Are they withdrawing from friends or family or activities that they used to love doing, right? We see a lot of people may withdraw or lose interest in things that they used to love doing. We see that a lot in depression, but that we may also see that a lot in somebody who is depressed and also feeling suicidal. Are we seeing increased drinking or relapse? We do see a lot of people who will self-medicate in a way to cope with some of those feelings of suicide or some of the numbness that they may feel that's associated with the depression or the anxiety. Or we may see unexplained anger. Maybe Johnny was a very easygoing guy and something happened in his life and now there's a lot of anger and it's kind of hard to explain because this isn't like Johnny. That could be a sign. So keep in mind that not everyone's going to come right out and say, I'm thinking about suicide. Sometimes we have to look at their behavior and some of their emotions too, to kind of give us an idea of, hey, something's wrong. I should probably bring this up. And if we see some of these warning signs, it is very important that we ask the question, but what does that question look like? So there's a couple different ways we can ask this question. We could directly say, are you thinking about taking your life? Now, I understand that this is a very hard question to ask somebody. It's not easy asking somebody if they're suicidal. It's scary for us. We may be wondering, am I saying all the right things? Am I noticing all of the warning signs? Am I doing everything that I can? And we're not asking you to go out and be a clinician and start diagnosing people or writing treatment plans or doing suicide assessments, but just being a friend or brother or sister, cousin, community leader. That's really all we're asking for here. Showing somebody, and that's really what that person may need in this moment, is somebody who is showing some empathy and saying, I understand this. I can't imagine what you're going through. This must be really, really tough for you. I wonder if you're thinking about taking your life, or are there times where you wish you can go to sleep and just not wake up, right? We do want to avoid questions like this. You wouldn't do something stupid like that, would you? And I get why that question is asked that way. And I hear that question being asked sometimes, and it comes from a place of fear. So I would want to challenge you, take a deep breath before you ask this question. Have in your mind what question you're going to ask before you do. Because the last thing we want to do inadvertently to somebody who we're worried about who may be suicidal is make them feel stupid for feeling this way. We don't want anyone to feel stupid for experiencing any kind of mental health issue that they have, right? And we also don't want to say, you're not thinking about suicide, are you? Because their response to that is going to be, well, of course not. I'm not suicidal. And not only did we give that person the answer, which is no, we also told them that we're not really in a position to help them out in the future. And if we're in a solid place ourselves, we want to make sure that we are in a place where we can help other people who we're concerned about. We want people to feel comfortable reaching out to us, but we also want to make sure that we feel comfortable enough knowing what to do. So we've asked the question, and let's say they say no. Well, from there, we would probably say things such as, okay, well, I'm going to keep checking on you. I'm just concerned about you. And I want to make sure you're okay. I care about you. And I'm here for you. And we'll talk about some resources that you can still give to that person at the end as well. But let's say they say yes. Here's some things that we can do. We want to make sure that we're staying with that person at all times. We want to make sure that we're removing lethal means such as firearms, pills, knives, ropes, anything that can be of harm to somebody. We want to make sure that we're escorting them to mental health, some kind of mental health facility or a hospital even. So we want to make sure that maybe we're the ones doing the driving. If you feel, and if there's kind of this agreement that it's safe to transport them in your own vehicle. We do want to make sure that we're staying with them while they're being assessed. So we may be out in the waiting room while they go and see a professional, and we want to make sure that we can stay with them, right? Especially if we drove them, of course, but we want to make sure we stay with them. Sometimes these can take a while. They can take a while to be assessed. We want to make sure that we're staying with them, just showing them that we care and we're going to be with them every step of the way during this process. And then we want to help navigate next steps based on what the professionals recommend. So, a professional may recommend doing what's called a suicide safety plan, and they may need a place to stay for a couple of days just until the crisis kind of subsides. Maybe they're going to do some outpatient therapy. Maybe they need to do inpatient therapy. Not every person who is suicidal has to go inpatient. It does happen sometimes, but it's not always the case. Um, so just kind of navigating and seeing what's the best thing to do to help this person that I'm worried about who's just seen the professionals, what do the professionals recommend? Because a lot of times they'll do a really great job of saying, these are kind of what we want to do, right? We want to get you contacted with a case manager, make sure you're making it to your appointments, seeing what other resources you need, and also here's your next appointment. We're going to start doing therapy as often as we need to, right? So kind of just staying with them and checking in during that process. And that kind of ties into being supportive. I always encourage people when they're working with somebody in their life, follow it up with a phone call or a text or a visit is always super, super important. And this will look different depending on the relationship that you have with the person. But follow up is so important because a lot of times people may get the help that they need. And then after things kind of get stable, that support kind of goes away sometimes. And it can start to reintroduce that feeling of being alone. So you want to make sure that you're following up and you're staying connected with that person as much as possible. We also want to let the person know that we care about them and that we're on their side, because a lot of people who are feeling suicidal feel kind of isolated from the world. They may feel alone. They may feel ashamed or guilty or feeling like, why am I having these thoughts? Something's wrong with me. I'm broken. I'm always going to be suicidal. So we just want to let people know that, hey, I'm on your side. We're going to get through this together, right? And we want to make sure that we're being patient during their journey. People who are experiencing any kind of mental health issue, it doesn't get better overnight, right? In fact, it can actually be a red flag if you notice that somebody is having a pretty bad time and is suicidal, and then that next day it kind of seems like a light switch went off and there's this kind of unnormal sense of calmness, right? That can actually be a warning sign too, because sometimes people may be accepting of the fact that they're going to take their life. So that's actually something to consider too. But overall, it takes a little bit for people to start working their treatment, working through whatever it is that's going on. It takes time. If somebody's prescribed medication, for that medication to kind of kick in. Sometimes medication can have the opposite effect. So this is a journey, right? It's a marathon, not a sprint. So it takes time. So we just want to make sure that we're being patient and that we're continuing to be supportive with that person, checking in, seeing if there's anything that we need to do. And of course, there's some really great resources. We promote these resources all the time. There's the National Suicide Hotline number. That number is 1-800-273-8255. Here in the next few months, actually, there's actually going to be a change in that number. It's going to be a 3-digit number, which is 988. So we're really excited about that. It is a countrywide initiative to change that number to a 3-digit number. So it's a lot easier to memorize. And we're really trying to normalize it the same way we've done 911. We know that's for an emergency, and 988 will be an emergency for behavioral health. So, but in the meantime, we still encourage everyone, you can use this number if you're concerned about someone and maybe you're not sure how to navigate through it, or if this person is in a suicidal crisis, they can call that number. Again, that's 1-800-273-8255. I always encourage everyone, just plug it into your phone so you always have it. There's also the crisis text line. Some people don't feel comfortable talking on the phone, right? Or there may be some other disabilities that keep people from being able to talk on the phone. And this is a great service for that. It's the crisis text line. You can text the word CREEK to 741-741. And within a couple minutes, you'll be connected with a crisis counselor that will kind of help you through that crisis that you're experiencing and connect you with local resources. So These are two really great resources that I always encourage people to have saved on their phone so they can pass it on to a friend, or they can use these services themselves. And if you're interested in further training, we actually do further more detailed trainings on suicide prevention. I would say the best way to find out more about those is we do them about each month. I usually host those. And we always make sure that we make a flyer and it's posted to the Muscogee Creek Nation Department of Health Facebook page. So if you want to go like that page so you can see all the upcoming events that are happening for those trainings, please feel free to do that. Or you can always call me at 918-758-1930. And what I'll do is put you on a list. And if you're interested in a training, I do them on Zoom. So all I need is a simple email address and we can make it happen for you. I want to thank you all so much for joining us on this video today. I hope that you found this helpful. I hope that you have just a little bit more knowledge and confidence on how to help somebody who may be suicidal. And just knowing that being empathetic and staying connected and supportive with people who you're worried about can make all the difference in the world. Thank you again. And again, if you have any questions, you can always call us at 918-758-1930. Thank you so much.